Good afternoon, everyone. How's everyone doing?
I'm fine.
Oh,
Good.
great, 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 great. Do we have everyone, Veronica? Or should we wait another minute or so?
So I told everyone we were going to wait until around 2:05. So if that's okay, give everyone 2 more minutes.
Perfect,
Okay.
perfect. So while we're waiting, I'm going to ask people to go in the chat and put their name and their favorite color to give us something to do for the 2 minutes, if you don't mind. First, I got to find the chat. I asked everybody to do it, then I got to find the chat.
And also too, I was going to ask everyone if they wouldn't mind putting their name, the institution that they are from, and their research interests. Nothing long or drawn out, but just
In,
just
in the chat, is that what you're asking for in the
yes,
chat,
in
Jerome?
the chat.
Okay. Don't listen to me. Listen to Devonia.
Yeah.
And their favorite color. So
Oh, I need to go back and do my research interest. So hold on, let me do mine.
okay.
I didn't do that yet, so let me do mine. I'm gonna just do it all over again. Rolling through blue. Um,
Oh, some people have two colors, pink and black. Okay. Well, I guess I can do mine too.
yeah. Wow. So, okay. Health equity and mental health, AD and medical comorbidity. Joe, I didn't know we had the same favorite color.
Yeah.
We 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 should we should now organize to wear blue at our next executive meeting.
That's a good idea. Yeah.
Yeah, yeah, yeah. That's what we should organize and do that. See, someone. Let me see. Emmanuel is dark blue. Okay, we got a blue clan going. Douglas is blue. It might be onto something with this blue. Well,
Yeah.
R is pink and black. Yes.
Mm.
Veronica's green. Okay, money green. We'll take it. And gold. Dr. Crystal Graham is gold. Okay.
Yeah, that's a good one.
That's a good color. Oh, Dr. Linda Anderson is also gold. Okay.
Okay.
All right. All right. Uh, okay, so you don't, there's flexibility in the color, right? Dr. Bala, I hope I'm pronouncing your last name right. He can feel. What is this about, Dr. Hughes?
I like island colors, teal.
Okay.
It's calming.
I've been on calls when you had a background, island background. I have been on calls that had the island looking background. Green, Dr. Molden is green. Okay.
Okay.
Green's coming in strong now. Oh, okay. All right.
So we're up to well 50. I think we were waiting maybe for like 9 more people, but I think we can go ahead and get started if that's okay with you.
Sure. We can certainly get started. And the thing is that this is being recorded, so we'll be able to get the recording probably in a place that people that can't make it, that they can access it. So welcome everyone to which is Johns Hopkins Alzheimer's Disease Resource Center for Minority Aging Research. Today we want to have we wanted to hold this webinar so that you can have to address some of your questions that you may have about our pilot program and just to give you an overview of our program and the HBCU initiative. We're really excited about this HBCU initiative that we're launching. This is a part of our proposal that we successfully was awarded about 2 years ago now. So I'm Roland Thorpe. I'm the co-director of the program. I have the honor of doing this this labor of love with Dr. Joseph Gallo. Next slide, please. So the Resource Centers for Minority Asian Research are the centers that are focused on developing scholars who are interested in advancing research around minority aging research around Alzheimer's disease and or other aging related health outcomes. There are 18 total centers. Um, there are 10 centers that focus on Alzheimer's disease. We have them listed here. The other 8 focus on other health related outcomes. And as you can see, there are a number of them across the United States. Not some of them do accept applications for individuals outside of their universities. Some do not. We are one that we've always accepted pilot applications inside and outside of our university. So to have this opportunity to launch the HBCU initiative is very exciting to us. Next slide, please. Our overall goals for our RCMAR is simple. We want to mentor a group of investigators who are focused on minority aging research as it relates to Alzheimer's disease related dementias, and we want to do that focusing using a life course perspective that's consistent with the NIA framework. The second aim is that, consistent with our pilot program, we look forward to working alongside of individuals like yourself to conduct Alzheimer's disease and related disorders research that focuses on either disparities in cognitive impairment, ADRD, dementia risk, or looking within minority groups, minoritized groups. And we want to use a framework, a life course framework that encompasses synergistic effects of how people operate as individuals, families, social network, neighborhoods, and broader communities. Next slide, please. So we're organized, our center is organized in the following way. Like I said earlier, I have the honor of working with Dr. Joseph Gallo, who's co-directs the center with me. And then we have an executive committee. And our executive committee consists of the following core leaders. Dr. Gallo and myself, we oversee the administrative core, and then we have a research education component. And that component is where our pilot program is housed, and a lot of our professional development activities will come out of those. And Dr. Marilyn Abbott and Farah Han are the two leaders there. And then we have a community liaison core, which is led by Dr. Quincy Salmons, Dr. Eileen Rosenthal, and Dr. Travonia Brown Hughes. And then we finally have an analytic core that's led by Dr. Jeannie Lacocas and Dr. Janice Taylor. The unique aspect of our analysis core this funding cycle is that we have leadership in both quantitative and qualitative research. And in the middle of quantitative and qualitative research, there's this methodology known as mixed methods. And I'm just happy to say that we have probably one of the world's leading experts in Dr. Joseph Gallo in mixed methodology. So we feel that we have a very, very strong analysis core that can help people advance research in this area. And then we also, in addition to our executive committee, we have a scientific advisory panel that we lean on to get advice on different things throughout and we meet with them annually. And then we also have a community advisory committee that works closely with the community liaison core, and we integrate the community members within the research education component, particularly as it relates to the thinking about how your findings can be translated to the community. We're very excited about that. This is how we're organized as a center, and this is our 7th year, right, Joe? 7th. We're going into our 8th year. We're excited about this, and we're excited about the prospect of continuing this work. And before I move forward on the organizational chart, one person that's not listed on here is the person that drives this thing on a day-to-day basis. It is Miss Veronica Washington. She probably got emails from her. So if you become a part of this family, and we want you to become a part of this family, I'm saying to you, I would prefer you answer her emails than answer mine because she's the one that drives it. She's the glue that keep this ship going. I just wanted to acknowledge that. And Veronica, we appreciate all the work that you do.
Thank you.
Next slide. Now I turn it over to Travonia.
All right. Thank you. So I am Travonia Brown Hughes. I'm currently an associate professor at North Carolina A&T. I'm also the director of the HBCU initiative with the Johns Hopkins Alzheimer's disease, RCMAR. And so the primary objective of the HBCU initiative is to help build research capacity among early and mid-stage investigators. So the initiative is designed to give faculty at HBCUs an opportunity to learn more about aging and Alzheimer's disease research opportunities, to learn more about the RCMAR program, the application process, career development, and NIH and foundational funding opportunities. Some of the activities that we do have planned is that we plan to host a professional development series to bring in both foundational and federal funders to talk about funding opportunities in aging research. We're also planning to host a conference, and this conference will be for both students and faculty in October here on the campus of North Carolina A&T. We also want to provide information about a national conference that will be held in Boston. That's the Gerontological Society of America this year. And we are hoping to be able to be able to provide some type of travel assistance to both conferences. Finally, we are also hoping to start an HBCU network database, and I'm really excited about this because we simply want to allow researchers at HBCUs to be able to connect to other researchers that are doing aging-related research and possibly to connect to mentors as well. I'm hoping that this will help to open the door to grants with multiple PIs from multiple institutions, as opposed to working in our own individual silos. And I'm hoping too that the database will encourage conversations with peers and also mentorship opportunities that researchers can build upon. I know sometimes it's very easy. At least I can speak from the perspective of having come from a small HBCU. I was at Hampton University for almost 9 years before I came to North Carolina A&T. And at the time, I was pretty much the only one doing aging-related research. So a lot of times I kind of felt like I was, alone, or I was working in my own little bubble. So again, having this HBCU network database will allow us to be able to make you all aware of different grant opportunities, opportunities for publications. You can work with other colleagues that have similar interests. I saw at least 2 people, that were interested in working with African Americans and looking at cognition, so that we're in the chat. So, I can't wait to reach out to them and say, hey, what are you all doing? What you're interested in, or what are you interested in? And how might we be able to maybe partner together? So again, I'm hoping that that network will open up a lot of doors, for all of us. So more to come with that. To follow is probably going to be a survey in which we ask you some more questions about your areas of interest. And, we get your contact information so that we can keep you informed as different developments, come up. Next
Travonia,
slide.
really quick, before we go to the next slide, I just want to add in that
Mhm.
Travonia was one of our first pilot awardees, and Travonia also, while Travonia was at Hampton by herself on an island, she had a mentoring team from up here, from afar. We did put our air arms around her and provide her with support. And Travonia has a RO1 now. Travonia's been very modest, but she has an RO1 now. And also those individuals that have similar research interests with Travonia. Travonia does have data from her pilot award. I don't know that could be possibly used for potential writing groups and things like that. So there are different opportunities that may be available to individuals. So please take advantage of the opportunity that Travonia says we're trying to create this. I'm really excited about the database as well. So I just wanted to add that, wrong. I couldn't let you go without telling them that you had an RO1, although you were down there by yourself, and we mentored you from there. So that was important.
Mm-hmm. I agree.
Joe, I
So
think you're
yes, I just wanted to say a few words about the pilot
yeah.
project program, and that overarching goal is to, as we said in the aims, to help investigators move their research forward. And the awardees become RCMAR scientists. These are 1 year grants, $30,000 plus the indirect costs for each pilot. And right now for this, we've extended the deadline to February 14th, and the start date would be July. February 14th is not that far away, but I think I'm going to show you that the application process is not too
Mhm.
onerous, I hope. What's next slide? So you're eligible if you're postdoc on track for promotion, or if you're junior faculty or senior investigators who've not received an R01 or are transitioning to Alzheimer's research. You're not eligible if you had one of these before. And as Roland said earlier, you're not limited to only Johns Hopkins affiliations. And of course, we're encouraging people from underrepresented racial, ethnic groups and disabilities to apply. Next. So what we ask so that we can review the pilots, our cover page with your information, an abstract in with the NIH type format, usually just text, no more than 5 page biographical sketch, the NIH format, a brief 3 page proposal that lays out the aims, the significance, the innovation, and approach, including any preliminary studies that you've done, and the references. The references do not count in the 3 pages. So we would expect Arial 11-point font, single space. Next. We also asked for names and contact information for 3 potential reviewers, and those should be, you should nominate people that basically you haven't worked with directly before, that you haven't collaborated on a grant or manuscript. We're also asking for a budget and budget justification in NIH format, and Veronica has all of these forms. If you need them, you can ask. And then just to put those in a single PDF so we can review them. The next couple of slides about how we review them. Next slide. So we have a review committee that gets together. We seek to get 2 reviews for each application, and we use a form and scoring that's similar to the NIH review. Next slide. And then investigators who are not funded, we offer to review the application with them and the review. If you are funded, then we want you to submit the IRB as soon as you can at that point, because IRB approval is going to be needed so that the project can be approved by the NIA, the National Institute on Aging, before the funds are released. And we strive to let everybody know by April 1st with the February 14th deadline. Next slide. And then, as part of our requirements, we expect you to meet the benchmarks, or agree to the benchmarks and meet them with the funding, provide us with progress and mentoring reports, and submit a final report 1 month after the end date of the project. In other words, in a year. I would add, we are really looking for publication to come out of the pilot project. So I would say final report, but the ultimate goal is a publication. And then have us, provide us with updates on an annual basis so that we can provide reports about how the program is doing to the National Institutes of Health. Next. And so there are a number of things. We have regular meetings for the scientists with mentors. Each scientist, I should say, has two mentors. One, if you're not at Hopkins, one is from your place, and another mentor that's usually going to be someone from Hopkins, and have regular meetings set up with them. But they're also, we expect you to be able to meet with the analysis core and the community core analysis core to help with reviewing the analytic plan and issues that come up, and meetings with the community core in terms of identifying either community resources or reviewing results, etc., sort of next steps with the community. Next. So I think we want to get into your questions. There are a few here. Maybe we can go through them quickly, Roland. Right? We'll go through them quickly. Can you include a co-PI on your pilot project? I think the answer is no. I'm
No.
looking at Roland, right?
No, this, you can't include one because this is a pilot for you and your development. And so,
Right.
and the NIA doesn't allow them. And we have to get all of the pilot projects, once we select them, they must be finally approved by NIA. So you cannot have a co-PI on there.
Can I conduct my pilot project in another country? I don't think we've had any.
No, we
And I
can't.
think the answer is no, right?
Correct. No.
Does the proposal need to include primary data collection, or can I use secondary data? You absolutely could use secondary data. We've had a mix of projects. Some are purely qualitative, which is a next question. Some are going to do focus group or set of semi-structured interviews. Some are purely using secondary data from a project or a national data set. And we have had mixed methods where someone's analyzing some data, but they're also doing some interviews to fill in more detail from participants. I don't know. Do you have anything else on that, Roland?
No, I don't.
Are the reviewers required to be a part of, are the potential reviewers required to be part of Hopkins, RCMAR centers, or relevant researchers without any affiliation to so the answer is C. They don't have to be related to a RCMAR center or a Johns Hopkins. Like the reviewers that you're listing as potential reviewers don't need to be at Hopkins or part of a RCMAR center. So there would be people working in your area who would be able to review the science, but they're not, they don't have an obvious conflict of interest. They haven't been on a paper with you or that kind of thing. So we asked for 3 of those. We're gonna, we try to get 2 reviews. So, but we asked for 3, so we have enough for when if people say that they're not able to do it. So I don't know. Are there? I don't think there's slides after that. Are there?
No, that's the last one.
Yeah. So I don't. I mean, I thought we just open it up to questions because these are the facts, but they're not necessarily the frequently asked questions of this group. So
So yeah, so let's open it up for questions, and let's open it up for questions.
we don't need to keep sharing the screen. Yeah.
We may have to point at something if someone has a detail about
Yeah.
something slide,
Yeah.
but yeah, sure. Yeah, Ashley, please go ahead.
Hi, good afternoon. Thank you for the overview of the pilot. I had a question. You mentioned the budget, you had to request it, but my question was related to the budget in regards to, are we able to include summer salary for ourselves if we're on a 9-month appointment? And could we also pay for support from a staff member? to help, like if there's some recruitment or aspects of working with participants to collect data?
Yeah, as long as they don't go over $30,000.
Okay, great. Thank you.
I mean, do you have any qualifications on that, Roland?
No, no. But just know that you want to make sure that you are budgeting sufficient resources to accomplish the goals. But one of the big things I want to remind people about this is, you know, it's a 12-month pilot, and you want to be using this as a pilot in and of itself. So, and NIH is going to review these for scope and feasibility. That's one of the biggest things. So, I wouldn't go out and say I'm going to recruit 1,000 people in a 1-year program, because that
Yeah.
takes that's going to be sick for a pilot program. NIA will look at that and think that will be not feasible to be done in a 12-month program. One thing I can tell you, you already know that if you're doing primary data collection, if there's something going to go wrong, many things going to go wrong. There are hiccups along the way, and so you want to, when you're thinking about putting projects together, think about things that can be done in an efficient manner, right? When you move forward. But yeah.
I mean, I
Thank you.
just to put a point on it, you put the salary support, but then other things come up. Like, for example, do you need to give the participants a token of appreciation, for example? There are other expenses. Maybe their publication costs you would include,
Right.
so um, I'm not sure that a budget will practically be, the whole thing will be those two things that you said, but
Right.
they're allowable.
Yeah, those are allowable costs, and you want to think. And one thing I didn't articulate is that the idea is to have a pilot project at the end of the 12 months. You are submitting the paper, so the manuscript development is a part of the 12 months. We've just learned that from our program director. These are the ways in which we should be thinking about the pilot awards and getting publications from the pilot award. There's been um, extreme directions to the directors of the centers that they want to see the pilot awardees papers published out of this, and we should think about having it within that window of time.
Yeah.
I see there's a question in the, I think, is there a question in the chat? Yeah.
There is from Liana
Yeah.
Lee. If I was not in the aging research field before, but want to be in the field, am I qualified to apply?
Yes.
Yeah.
Yep.
I don't know. I mean, could elaborate on it, I guess, if you want. I mean, maybe in your personal statement or something, right? You might be explaining something about that, or I suppose if I were giving you advice, I mean, you might explain it to the reviewer, what's going on.
Right.
But there's no,
We've funded some people who've come to some senior people who've come
that's right.
to us that had no agent related background. So yeah. Anything else?
Yeah, I have a question.
Please.
How many awards do you give out? And is there a distribution by stage of career?
So we're funded every year to give out 3 awards, right? So it's 3 awards per cycle, and the distribution of funding by career stage, we largely, I don't have the exact numbers, but we largely are funding early career faculty. So I would say, out of a guess, I would say over 75% of our funding for the pilot awards have been focused on postdocs and early career faculty members, right? We have had some senior members that a couple senior people who were coming into aging research, and they have gotten awards as well. But the directive from the from NIA is to largely focus on early career faculty members.
Great, thank you.
But I would still encourage someone, even if you're like a mid-stage investigator and you have you feel like you have a really strong idea to apply, because if nothing else, you can get feedback, and it gives you a chance to even make some connections, that, hopefully you can take that information and use it to continue to move forward. So.
Great, sounds good.
Yes. Douglas?
Yes, good afternoon. Is there a website or well, is there a website that we could go to where we can see previous projects that have been funded to make sure we're not recreating the wheel or not doing something or doing or creating a idea that's already been done?
Yeah, so we're in the midst of updating our website now, where we have the list of all our previous funded pilot awardees and the titles of their pilot pilot projects.
Okay, thank you.
Veronica, could you put the link to the
Yeah.
current website? That would be helpful. Thanks.
Yeah.
And I wanted to ask you all a question. So as far as the professional development series, can you all share with me some topic ideas that you might be interested, in having us to cover? So if you're at a smaller institution versus a larger institution, or, you're at an institution in which you have a heavy, a course load, you're trying to figure out how do I manage it all? Again, what are some career development like topic ideas that would be helpful to you? And you can either like put it in the chat, or if you want to, kind of elaborate, that would be great.
Veronica, I think it's going to be helpful to save the chat before you log out. We've got a lot of information that's going through the chat. So before you log out and close us out, you want to save the chat so you can capture all this information.
Hello, I'm Sangeeta. I have actually two quick questions, and thank you for your time for helping us to understand all the information about the pilot grant. So, I'm a research associate from Fayetteville State University. My area of research is completely different. By the way, you are able to hear me, right?
Mm-hmm.
Yeah.
Oh, perfect. So, my area of research is a material science. It's completely diverse by the topic that you are mentioning. However, in the past, in my PhD and postdoc, I have built a material. It's an inorganic compound that will detect a zinc element that is associated mainly to Alzheimer's disease. So, uh, I mean, belonging to this topic and this area, am I able to apply for this pilot grant?
I mean, it's not limited to social sciences, right? So if that's what you mean, it's sort of laboratory based. I don't think it's limited to that. Would you agree
Because
with
this is
that?
completely related. I mean, the work that I'm like the title would be using a inorganic material compound to detect or for the drug delivery of Alzheimer's disease.
Yeah, so you're talking about drug delivery and Alzheimer's disease, right?
Yeah, either drug delivery or detection. The material can be used for the detection as well.
Yeah. I don't see that as being a problem. I think one of the biggest things is then we need to think about and this is you know something for us to discuss about in leadership. We make sure you have the appropriate mentorship and things like that. Yeah.
Right. That's right.
Okay,
Yeah.
and if I would like to write and proceed with this, do I need to add any undergrad in this?
Not required to write an undergraduate in this application, but if you want to put in there, there are you could use funds. That's an allowable cost, but it's not a required cost.
Okay, great. Thank you.
Mm-hmm.
Okay, so no one put anything in the chat, so I
Just gonna
still need
say,
to
yeah,
know
right.
for a professional development, series, what would be a topic that, you'd be interested in attending? I know we talked about funding, federal funding, foundational funding, everybody's into funding and opportunities, but beyond that, are there other career development type of topics that we can bring in someone or have an expert to come in, to talk to you all about? Is there any other topic that would like be really helpful? Or if you saw it come across your email and you're like, wow, I want to tune into that.
I was,
So
I'm sorry.
Go ahead.
go ahead, bro.
Hi, Jerome Moden. I was interested in maybe a topic on grant writing.
Okay.
Not only just grant writing, but applying for grants and searching for available grants.
Okay.
And say more about grant writing. You say grant writing, what is it that you're
Mhm.
looking for? Grant writing is huge. So what is it that you're looking for with grant writing?
As far as tailoring a proposal for a specific grant, whether it's NIH, NSF,
Yeah, okay.
private grants, yeah.
Okay. All right.
Mhm.
All right.
Mm-hmm. That's a good question.
Yeah.
Something uh something in the chat I can try. It just came up.
Okay. So does research topics need to be limited to Alzheimer's, or can aging topics in individuals with other conditions such as diabetes, neurodevelopmental disorders, or HIV be included? So, can it just be HIV or diabetes?
no,
Okay, so it has to be some type of like
right.
dementia and diabetes
Our
or okay.
cognition. Right,
Okay,
right.
got it.
Because we're the 80 RCMAR. Now,
Mhm.
if you want to talk about HIV or diabetes focus or hypertension, they have 8 other centers that you could apply. Well, there are 8 other centers that are available, but I don't know of those 8 who takes applications outside of their university. Ours has to be around you go back to the aims. Ours have to be around cognition, cognitive decline, or Alzheimer's disease and related disorders.
But it could be comorbidity.
Yeah.
Yeah, but it could, as an exposure for the outcome of cognition or ADRD. Right. Yeah, absolutely.
Right.
And someone also put publication for new
Uh,
researchers. So what do you mean about
yeah. What do you mean by publication?
yeah, like picking the right journal, or is it
So,
finding the time, or
Oh, thank
yeah.
you.
What is
That
it?
was me as well. I was thinking more picking the right journal.
mm,
Okay.
okay.
All right. Yeah. Okay. Also, one of the things I wanted to say to this group is that, I know Travonia has raised the issue about a professional development series. The RCMAR itself now has a professional development series where we meet monthly. It's the second Friday at 2 or 1. What is it, Veronica? See, that's why I've
Usually
asked Veronica, is it 1 or
one.
2?
Yeah, this is
It's 1.
second Friday at 1, from 1 to
At
2.
1. Yeah, at 1, and we already have a list of things that we're doing there. And if all of you all are interested, we certainly could put you on the distribution list where you could come and listen to some of the things we have of research in progress, where the current scientists give us updates. Then we also hear from the scientists that have finished. They give us updates where they give their final presentation, and then we talk about different data sets and different professional development things. Dr. Marilyn Albert does a wonderful, wonderful presentation on how to create your bio sketch. Those are just some examples of things that we do. In addition to that is what Travonia is talking about. Are there any other career development things that we would do outside of that professional development seminar series? So that's why she's asking. And if it's not, it's okay, but we want to provide the opportunity. Joe, you were going to say something?
Oh, sorry. I was listening, but in the chat I put, not everybody knows about Jane, where you can put an
Oh,
abstract
yeah.
and you get suggestions for journals.
Yep.
I mean, you can't always sort of take it to the bank, but it at least generates ideas where to publish. Somebody was mentioning that. But there's another question in the chat too about can the reviewer be from the same institution where I work?
Yes, yes, but the reviewer cannot be, so they can be from the same institution where you work, but they cannot be, you can't have a conflict with them. It's like you can't have like published with them within a certain period of time. We do it here. We have reviewers. Some of our reviewers for our pilot awardees are people at Johns Hopkins, and some of the people, the awardees are at Hopkins. The applicants would have been at Hopkins. So we can do that.
And I would just add, I would encourage you all to really take advantage of the professional development series that is offered by the RCMAR, because they bring in experts from literally across the country. You know, because of Zoom now, you know, we can bring people in from wherever. And so you get a chance to be exposed to really cutting edge research and ask these people questions and even follow up with them, you know. If it's a topic that you have a really strong interest in. So, you know, do take advantage of those opportunities. So I think we're pretty much like coming to the end. Thank you all for coming. It was so good to see so much representation from HBCUs from across the country. Again, I've pretty much only worked at HBCU, so of course, and graduated from Hampton. I'm an alumni, so I have a lot of pride. And also Roland, he's from Southern, right, Roland?
No,
Or
no, no.
FAMU?
I'm from the only HBCU. It's Florida A&M.
Anyway,
Yeah, no, no.
anyway.
Hey, but before you close out, I was just before you close out, is I would just like to see by show of just raising your electronic hand, was this helpful, and is this something that you would like to? Is this a group that you would like to continue with? Because there are some things that we could do. You know, I don't. You know, one of the things that I've been thinking about is people. You know, I thought about this is not on the agenda. This wasn't what we were talking about, but you got to publish papers. You know, what is it like to publish papers? What is the publication process? You know, Joe Gallo and myself and Travonia, we know a little something about publishing, and we are happy to share and help people think about the publication process, writing, and what does it mean to have a writing plan and all those types of things. You may already have all that, so that's why I'm not making the assumption. That's why I'm asking the question, and that's why Travonia was asking the question earlier about career development.
Mhm.
Yeah, we're not making any assumptions. We're just trying to here to open to be a resource, a potential resource for you.
Mhm. Mhm. Yeah, and I want to come up with a program, you know, that's relevant and that's helpful. You know, it's not just another session that you attend for an hour and then you walk away feeling like, you know, you could have done something else, you know. I would like this to be a program that again, we're able to really connect with each other. And because I mean, sometimes through networking or through numbers, you know, there can be power. And there can
Hmm.
be opportunities that is again, because I came from a very small HBCU that you're just not aware of. You just don't know, you know, and not everybody can attend like a national conference and get out there and make those connections. So to be able to make them, you know, without having to go to a national conference, you know, it can be very helpful for your career. So.
Yep. There was a question, I think. Yes, please go ahead.
Yes, I have a question. Do I have to have collaborators in a group or just apply alone?
Mhm.
Or I have to have a collaborator?
No, no,
No,
No,
not
apply
okay.
alone.
you're not
Okay,
right.
I have
You're not.
another question. So, we only have undergraduate students, so I'm gonna, so in the grant, do I have to give them like wages or stipends should be enough?
You budget that,
Mhm.
so
Yeah,
we're
but
not gonna. You
you don't
you
have a
would
limit, right?
what?
You don't restrict us to do certain things like we can give them a wage or we can give them either stipend too.
Yeah, you can do what your university allows you to do,
Oh,
right?
okay.
So we're not, but again, these things have to go through approval at, we look at the budget and then if we have questions about the budget, we may ask clarifying things before we send the recommended applications down for approval. And I can tell you, Joe and I know for firsthand experience, they scrutinize everything on them. And
Oh,
they come back and they ask it. So, I think if you're writing in students in the to say you're going to pay students, I think that's it is an allowable cost. And you just justify it. I'm gonna pay them
oh yeah.
whatever the university rate is at 15 hours a week or whatever. I think that's very reasonable. Now saying that they're going to work 40 hours a week is not reasonable at all as students. That won't work.
Oh yeah. I think we have 10 hours per week limit.
Yes,
Yeah.
that's fine.
And
Thank
it
you.
also depends on why you're utilizing students. Like when I did my pilot study, I utilized my rotation students. I was in the School of Pharmacy,
Mhm.
so I couldn't pay them, but I could, the hours that they worked for me counted towards their rotation, or
Right.
you could do an independent study class with a student or students, and the credit that they get is through working with you, with that independent study class versus if you were doing some type of community project and they're going out and traveling and going to different places in the community, and that's not a class, then yeah, you would probably have to reimburse them for their time. So it kind of depends on what you're doing with the student.
Oh, for my current case, student work with me in the lab work, I always pay. So
Okay, well, that's something that you normally do anyway. Okay.
yeah, and they're, I mean,
Yep.
need it too. I mean, student, financially really need it. So
Okay.
Yep.
thank you.
You're welcome. Crystal, we do have your information. Thanks for sharing it. I see it in the chat. I'm just acknowledging that we see that information in chat.
Mhm. So there definitely will be more to follow, So, again, I think the next, again, email you receive from us will probably be like an email that has a survey link attached to it so that we can start to build that database. And also, too, if you know of other colleagues that are interested in aging research or have an interest, please do spread the word or spread the link that we give to you, so that we can collectively start to build up that database, um, together so that we can have our own working, network of aging researchers. So,
One last question. So the indirect is at the university's rate, like you don't have a fixed rate of maybe 10%. So if our university indirect is, if the rate is, let's say 50%, we have to pay that out of the 30,000.
No. So that's a good question. No, you don't. The $30,000, the direct cost. This is because it's a training component. We're all NIA only allows us to pay 8%. So we will send 30,000 plus 8% to your university. The 8%, the university gets the 8%, you get the 30, and we do some great work.
Fantastic. Yeah, because that was a point of confusion.
Absolutely. And that was one point we forgot to share. That's a great question. Thank you for bringing that up.
Glad you brought that up.
Yeah. Mm-hmm. Anything else?
I would say if you have questions, if you're preparing a pilot, let us know.
Right. Let us know. I'm going to, if I can spell my name right, put my email in the chat. Certainly feel free to email me about any questions about the pilot or any other career development questions that you may have. Joe, Livonia, and I, we all have track records of mentoring people and developing them. So I think if you do have any questions, please feel free to reach out. You put it in the chat. And Joe he just sent his in the chat as well. And Travonia, there we go.
There you go.
Yeah, the pink and teal colors. For the blue crew, Joe. So yeah. All right.
All right. Well,
All
I
right.
look forward to hearing from y'all, and also again be on the lookout for more information about our aging related research conference in October. So looking forward to even meeting you all, in person. So
Thanks so
All right.
much.
all
Thank
right.
you. Have a
Thank
good day.
you
Have a good
all.
weekend.
See ya.
Yeah.
Thank
Can
you.
just the core group, Dr. Gallo and Veronica, Roland, can you all stay on for just like
Yeah.
5 minutes?
Yeah. Can you turn the recording off, please?
Mhm.